going to utilise a model that has been tried and tested and it's evidence-based, okay? So you have your risk management process. You should, at a minimum, have a risk management policy and procedure, which incorporates all the fun stuff we were talking about in the legislation specific to your sector, okay? You should have an individual risk management policy and procedure. That might be your assessment and care planning policy and procedure for your facility, or it might be that this individual risk management plan, policy and procedure is incorporated into your care planning and your risk assessment policy and procedure, or you may want to keep it separate. It depends on the facility and how you want to break it up, okay? But naturally it would lie with your assessments and your initial introduction of your resident or service user and your care planning policy. Your health and safety management policy and procedure is very much around your fire, your infection control, all of the risks associated with the facilities and the environment. That is covered under your health and safety risk management procedure. Okay? Risk registers then, okay? You should end up with, at the end of this process, a corporate risk management register, a service and care provision risk management register, your individual risk management plans in the service user's record, and your health and safety work welfare statement and your health and safety risk register. Your health and safety and welfare statement needs to be displayed publicly. Okay, so that's a little check for yourself. I don't know, somewhere where your service users and anyone using the facility will be coming in, and it needs to be reviewed on an annual basis, and it needs to be signed off by the person that holds the most accountability. So maybe a CEO, it might be board of director, whomever that is in your particular facility, but it does need to be displayed, okay? And what that does is, we talked about service users and families and representatives having the security knowing that health and safety is recognised in the facility that they're in, that it's part of everyday practices. It gives stakeholder confidence that health and safety is managed appropriately. Okay? So this is not a health and safety course, so I'm just going to skim over that, but that's a very high level requirement there. Okay? Now, all of our risk management processes then feed into your incident management process. Okay? So you will need a separate policy and procedure on the management of incidents. Okay? You may or may not want to consider incorporating into your incident management policy and procedure management of serious incidents, investigation, or you may decide you would like to keep that separately. In my opinion, I would keep it separate because it's such a huge document. Or you can refer to in your policy that you will use this guidance framework and list who will be responsible for what areas in the policy. Okay? But you do need to recognise the serious incident management framework in the HSE in your policy. Okay? Everybody okay so far? Now, let's have a look at roles and responsibilities around the risk management process. So we talked back when we said there was a lack of clarity around who was responsible, who had the role for signing off, making sure we empower staff, that it's not just one person that does everything. Your corporate risk management register should be overseen by our management team. Our management team will be a selection of different disciplines, right? So on a typical management team, who would we have? Director of Nursing,
General Manager, CEO.
General Manager, CEO, or HR Manager maybe, Operations Manager, or Facility Manager. You may have somebody representing an MDT team. Depending on the facility, it might be a Clinical Director. It depends, okay? A pharmacist, whomever that. Okay? And you have your risk register should be approved by the registered provider for the facility. Okay? So that is the person that physically signs off on the risk register. Okay? And the policy. Alright. So your service and care provision risk register should be overseen by a multidisciplinary risk management team. Okay? And depending on this this team, they may decide they want to meet monthly or quarterly, depending on what's occurring in the facility at the time. If there's a lot of change going on, they may decide monthly, and if they feel that the risks are appropriately controlled, they may put a change control plan in place and meet on a quarterly basis. But the important thing is that your terms of reference are identified and that you have a meeting structure in place with agendas and minutes maintained for all meetings, for all of the different disciplines, to demonstrate that risk is appropriately being managed in the facility. Okay? That risk register will be approved by the Director of Nursing or the person in charge. Okay? Generally somebody from a nursing background. Okay? Your health and safety risk register, as we discussed, contains all the non-care elements, your health and safety, your fire, PPE, infection control. Again, multidisciplinary risk management team, because there is a slight crossover between these two, specifically around infection control, okay, and hoist management. And so there is an interlink between these two teams. And this is approved again by the registered provider. And last but not least, our individual risk management plans are again looked at and reviewed by a multidisciplinary care team, okay? So the caring background approved by the Director of Nursing or person in charge. So when we look at clarity around roles and responsibilities, that is the clarity there. The ultimate responsibility, the input is here, and the ultimate responsibility lies here. Okay?